I think this online map looks like a good tool. I understand it's well validated. What do you need to know to make use of it?
The most important thing to know is about the Black Dog model of depression, the subtyping model of depression.
It helps me to determine whether medications are appropriate for my depressed patients and which medications to use.
There's an online interactive program on the website that you can just go to and learn about the model. So probably the best thing you can do after you learn about the model is to register as a referrer to the online map and then get on and do the map yourself as your patients would be doing. Because that gives you some insight into what the experience is like for the patient, so you're much better equipped to talk to them about the experience. And it also gives you some clues as to how the questionnaires feed into the final report that you get. And that knowledge is really important when you're interpreting the report. I can actually show you what a report looks like if you'd like.
Yeah.
This will be a mock-up report that I've done for a workshop. Let me just see. Okay, yeah, here you go.
Okay.
This is the first page of the report. This is a general page which just comes with every report and tells people a little bit of basic information about the model in case they're unfamiliar, and refers them to places where they can get more information. This is the first page of the actual report for the patient, which shows the demographic information, some information about their current episode, if they're currently depressed, the severity of the episode, their functioning within that episode, and some background factors. Useful information, and it may well cover some stuff that you might have left out of the clinical assessment, which is something that happens to all of us. The next page is the result of the algorithm which sorts patients into melancholic or non-melancholic depression, and I know you know the significance of that. The next page is the result of the Bipolar Screening test, which gives you a good indication of whether you've got to think about bipolar disorder in this particular patient. It also gives you an indication of whether there's likely to be any psychotic features, and that's important. It doesn't tell you that there's definitely psychotic features, because you've got to go back to the clinical assessment to confirm that. And some more historical information there about anxiety conditions in particular. You know, this is a depression questionnaire, not aimed at looking at anxiety, but there are some anxiety screening questions in it. The next few pages contain information about current and past medical conditions, about stressful situations in their life recently and over time, and about current and past treatments for their depression. And the very last page is the results of the Personality and Temperament Questionnaire, which you may have seen on the website already. It's available outside of the map. And you probably know already that what that gives you is a wonderful summary of patients' personality vulnerability. So it gives the psychologist that you refer them to a really good knowledge of the patient in summary, and an idea of where to go with their treatment. So from that point of view, it's a very useful thing to have.
So how reliable is all this?
Well, it's a self-test. 80% is considered very good reliability for a patient self-test. The algorithm that screens for melancholia, the subtyping algorithm, has 79% reliability at the moment, according to our current assessment. And the bipolar algorithm, the bipolar screening test, also has a 79% reliability. So that's pretty good for a self-report test.
Yeah, it certainly sounds useful. I know I'm happy to use it. I guess it's not going to be appropriate for everybody, but yes,
it's true. Everybody finds different ways of using it, but overall, I think it is well accepted and very useful in clinical practice.